Program planning for priority populations. The future is planning. The purpose of planning is to create the future. Planning programs for priority populations. The purpose of planning is to create the future. Planning reduces uncertainty and produces a systematic roadmap as to how to achieve the intended goals. So let's look at the program planning process. Program planners, with the help of participants from the target group, need to define what changes need to be made. Is it increasing access to screening, developing skills to reduce risk, providing educational materials in different languages, etc.? And program planning asks several important questions. Who is the program attempting to inform, influence, or persuade? What behaviors, attitudes, issues, and/or knowledge base should be targeted for change? How will the program be delivered? Will it be delivered online, in person? What are the most effective methods for reaching this population? And this speaks to recruiting. When will the program be implemented? What resources are needed to develop and implement a high-quality program? Who will be responsible for implementing the program? What are the most effective intervention strategies to address the problem? What are the potential obstacles to success? And how will success be measured? Program planning also includes a health equity component into program evaluations. It asks the question, is this program or activity having the same impact on all members of our community? And are there certain groups who are benefiting more or benefiting Program planning also includes a health equity component into program evaluations. Is this program or activity having the same impact on all members of our community? And are there certain groups who are benefiting more or less from this program than others? Now let's look at steps in the planning process. We need to gain access to the community. And one should be very alert to the fact that suspicion and mistrust are alive and well in communities, especially when someone who's not from that community attempts to start doing research or a program and no one knows anything about that person or organization. So, identify key individuals who can help you gain access. We often refer to them as key informants, and they include elected officials, leaders of faith communities, members of civic organizations, etc. Involve the target group in all aspects of the program. This is a basic principle of community engagement. Remember, you're working with the community, not on the community. Community members need to be engaged in conducting research assessments and development of intervention. And it is often important to create a community advisory board. Develop partnerships with local organizations. This partnership allows for the legitimization of the project, promotion of the program, and sharing of some program costs such as printing, advertising, or refreshments. And a lot of times, a partnership will be legitimized with a memorandum of understanding, which is a document that all partners would sign. The partnership also allows for developing partnership with local organizations, also allows for training of lay health advisors to work on the project, recruiting of program participants, and dissemination of findings and reports. Assess the needs of the community or target group by conducting a community needs assessment. Decide on a planning model or framework, and several of these include the pre-seed proceed, the health belief model, the PEN 3 model, social ecological model, the intervention mapping model, and social marketing model. The program's missions, visions, policies, procedures also must be clearly articulated. In addition, realistic and measurable program goals and objectives must be outlined. So, make sure that these are compatible with the community's goals and values. Have a specific plan to recruit and to retain participants. Sometimes you may be successful at recruiting people to attend maybe your first event, but will they come back? So you also need to have a specific plan to keep them coming. Have a specific plan to promote and market your program. This needs to be part of your budget. Community needs assessment. Needs assessment is the process of assessing and defining needs, opportunities, and resources involved in initiating community health programs. The assessment should be done with the community, not on the community. And citizens and organizations must have a sense of ownership of the program. Community needs assessment methods include surveys, talking with key informants, interviews, focus groups, town hall meetings, citizens forum. Existing data can always be acquired. Sometimes this could be newspaper data, where that has been documented by the media, but also a lot of data can be obtained from the health department or even the state database, and also census data. We are now in the era when a lot of these can be done online, especially surveys, speaking with key informants through video chats, as well as conducting interviews, focus groups, town hall meetings, and citizens forum. This is our new normal at this point. The community needs assessment methods also include data from the American Community Survey, using the nominal group process, Delphi technique, observation, site visits, getting expert opinion, other types of citizens' feedback, as well as media coverage. Projects that receive state and federal funds are often required to have adequate plans to include women, minorities, and children as appropriate for the scientific goals of the project. After the data are collected, interpreted, the program planning team must decide which health issues need to be addressed and prioritized.